Welcome, viewers, to today's segment in our health series. Our topic today is on diabetes. My name is Laura Falt, and I'm the Director of Business Development here at Riverside Health and Rehabilitation in East Hartford. I am pleased to welcome my guest today, Katie Gustavesen. Katie has been a registered dietitian and a certified diabetes education and care specialist for the past 15 years. She currently works at ECHN's Manchester Memorial Hospital, where she is a diabetes program coordinator. Thank you, Katie, for joining us to share your knowledge and expertise on diabetes, which unfortunately seems to be a health crisis among all age groups today. According to the American Diabetes Association, 7 million people with diabetes are undiagnosed and 1 in 3 are at risk. I guess I would start by saying, given these statistics, why are so many people undiagnosed, Katie?
And thank you for the lovely introduction. I'm very happy to be here today. So especially over the past year and a half, we have had a lot of things on our to-do list, and we may have not gone out and about to our regularly scheduled provider visits. And, sometimes we just put things off, like doing our laundry or putting the dishes away. And sometimes we don't get around to those tasks, or they're not necessarily prioritized, because some things just sound a little bit better than going to your primary care physician or whoever you see that's taking care of your health. But when it comes to being diagnosed or treated for having diabetes, waiting isn't necessarily the best option for you. So typically it's going to start with going and seeing your physician. And because we don't want it undiagnosed or untreated, because if you haven't had recent lab work or undergone regular screenings for high blood sugars, then you don't technically know if you actually have it. And by having prediabetes or type 2 diabetes, you don't always feel those symptoms of feeling thirsty, urinating a lot, feeling very tired. Sometimes our numbers are a little bit elevated, which still puts us in the diabetes range, but you don't necessarily, you feel the same. You feel normal, so why go to the doctor if you feel normal?
Thank you, Katie. And actually, that leads me into my second question, which let's say when you do go see your physician, they say you're pre-diabetic. What does that mean in terms of lifestyle changes? And what can you do to redirect your habits so that you don't develop diabetes?
Good question. So some individuals might have been told you have borderline diabetes, you have prediabetes, you have a touch of sugars, you better do something about that now. So there's 3 different areas that I really want you to focus on. It's normal numbers. And then we got normal numbers, let's say, are green. Prediabetes numbers are gray. And then type 2 diabetes numbers are red, let's say. So in the prediabetes range, you're gray, which means if you don't do something within 3 to 5 years, the statistics show that you will develop type 2 diabetes. So that is something to address right in that moment. And we have a diabetes prevention program, which we can get to at another time. But what does prediabetes actually mean? Even if your doctor may not seem too concerned about it, you should take that seriously, because there are things that you can do. So usually, if you're going for lab work, your fasting blood sugar is between 100 and 125. That is elevated. A fasting blood sugar should be under 100. Under 100 is green. Between 100 and 125 is that gray area, that prediabetes area we mentioned. Or they might be checking a hemoglobin A1C. A hemoglobin A1C for people who have prediabetes are anywhere from 5.7 to 6.4. In the green area, it's underneath 5.7. So prediabetes is that gray range. So what can you do? Or why are people even at risk for prediabetes? Well, your age certainly plays a role. So the older we get, the more likely we're to develop prediabetes or type 2 diabetes. But if you had gestational diabetes, you're at risk for developing type 2 diabetes. So women who had gestational diabetes or had a baby weighing over 9 pounds, you're put more at risk. If you're inactive, if you have hypertension, if you have people in your household or relatives that have type 2 diabetes, you're put more at risk for getting prediabetes and even type 2 diabetes. So screening pretty early, not just waiting until you're 60 or 70, the screening process really needs to start sooner. So with preventing type 2 diabetes, and if you're in that prediabetes range, there's a few things that we are looking for you to do. One is eating well. And eating well, I think, can be very confusing being in this time frame with lots of social media and lots of nutrition gurus out there. So finding ways to consume a little bit less than what you're consuming, increasing your protein, increasing your vegetable intake, finding ways that you like vegetables. So it's not necessarily taking things or eliminating things completely out of your meal plan. It's what else can you add in to make it a more balanced meal plan. It's also moving your body. Don't think of it as exercise. It's just adding in more physical activity throughout the week and being consistent about it. Remember, these are lifestyle changes that we need to be making. It's not just going to happen overnight. If you've been inactive your whole life, well, 10 minutes twice a week is better than 0. But our main goal is to get up to a minimum of 150 minutes of physical activity every week. So what that looks like is 30 minutes 5 days of the week, or about 22 minutes every single day. And it could be 10 minutes in the morning, 10 minutes at lunch, and 10 minutes at dinner time. Breaking it up is certainly okay as well. Now, when you're changing a little bit what you're eating, where you're managing your stress a little bit more, if you're increasing your physical activity, most times that leads to decreasing weight. So when you're in that prediabetes range and you lose about 5 to 7% of your current body weight, so what that looks like, if someone is a individual who weighs 200 pounds, 5% is just losing 10 pounds. So in the grand scheme of things, if you're thinking, man, I got to lose 75 pounds, start with the first pound, then the first 5 pounds, and then 10. Even just a little bit can make a massive difference in your blood sugar readings and along with cholesterol and blood pressure as well. And with our diabetes prevention program here at ECHN, we do have a year-long lifestyle change program that meets for 24 hours out of your life over a year that can help you manage your blood sugars, and it may be free to you.
Thank you so much, Katie. It's amazing on how just those small changes can make a big difference. My next question would be, what is the difference between type 1 and type 2 diabetes? And if somebody is pre-diabetic, does that automatically mean that it's, that if they were to develop diabetes, it would be type 2? And if you could just talk about risk factors that may be unique to each type of diabetes.
So we'll start with, out of those two types, between type 1 and type 2, we're going to start with type 1 diabetes, okay? So type 1 diabetes is when your body makes little or no insulin. So type 1 diabetes is when those folks need to start doing insulin injections every single day. But this doesn't always occur in children or adolescents. Yes, it does. It used to be called juvenile diabetes, but it's no longer called that anymore. It can happen later on in your life as well. And this only happens to a very small percentage of the population. About 5 to 10% of everybody who has diabetes have type 1 diabetes. So risk factors and the causes aren't entirely known at this point in time. There might be a family history of having diabetes. There might be other environmental factors involved, just to name a few things. But there are tests that your providers can take to determine whether you have type 1 or type 1 diabetes. So with type 2 diabetes, which is the most common form of diabetes, which happens in 90% of our population, some of the risk factors are age. If you're over 45 years of age, you're more likely to develop type 2 diabetes. If you have a family history of type 2 diabetes, if you're overweight per your BMI, body mass index, if you're physically inactive. So remember I said earlier, you should really be moving your body 30 minutes, 5 days of the week. Well, if you're doing less than that, we're considering you inactive. If you belong to a high-risk ethnic group, like if you're Native American, if you're African American, Hispanic, Asian American, Pacific Islander, again, that puts you just at a higher risk. And again, those women who have had gestational diabetes in the past, those can put you at risk for developing type 2 diabetes.
Thank you. I think that many a times when we think of diabetes, we think of it as, needing to control our sugar. And yet we do know that there are other health complications that can develop when diabetes goes uncontrolled. Maybe you could take a few minutes to just touch on those other health conditions for the audience.
So you're right. There's many things that go into managing your blood sugars, like food, nutrition, actually checking your blood sugars, medication, and stress management. So overall, what we're really looking at is that A1C, or what your blood sugars are. So in that red area of having diabetes, and I'm going to speak upon type 2 diabetes, your A1C is over 6.5, or your fasting blood sugar is over 126. So the longer you have diabetes, or the longer that that A1C is not in control, meaning it's above 7, it might be 8 or 10 or 12 or 15 for years, the sugar in your blood, instead of, like a water bottle, if it's going back and forth, it easily glides back and forth. But when you have sticky blood, when you have higher blood sugars, it's like Hershey syrup, or it's like molasses in your blood, which can lead to those complications that people hear about, such as numbness and tingling in your fingers or in your toes, known as neuropathy, which could lead to potentially an amputation, lead to heart disease. Blood touches everywhere in your body. So it's important to get your eyes checked every single year because blindness is one of the leading causes is diabetes. It could cause kidney disease and dialysis, just to name a few things. And those are all the things we want to avoid by getting proper care with your health management team, doctors, nurse practitioners, educators, counselors, behavioral health, all those things. And we're on your team to help you manage your blood sugars.
Thank you. I know that through your work as a diabetes coordinator and over the past 15 years working with patients that have diabetes, do you have a quick success story that you might be able to share?
Sure. I actually pulled one, so I'm just going to read right off of it, if you don't mind. The Diabetes Wellness Center has rejuvenated my efforts to take care of myself. Today, after 2 months, I'm a new man. Good lost weight, better eating, feeling good about myself. I would recommend the program without reservation. It's a proper investment, covered by insurance or not.
Thank you so much for sharing that. And I think that hearing stories like that makes us all realize that if we are diagnosed with prediabetes or diabetes, that we have options to maintain a health, to redirect and to live a healthy life and feel good. I would like to thank Katie for joining me today. If you want more information, you will be able to read on your screen ways that you can get in touch with Katie directly. And of course, I am always a resource and available at Riverside if you're interested in anything that I can help you with. The number to reach me directly is 860-335-7526, or you can always email me at lfalt, that's LFALT, at nathealthcare.com. And thank you, viewers, and we look forward to our next program in our health topic series.